Hello and welcome to the second session in Core Canada's new health promotion series, Age-Friendly Communities, a key strategy in promoting the well-being of older adults. My name is Barbara McMillan and I'm the Provincial Community Engagement Coordinator for United Way, British Columbia's Healthy Aging Department, and one of the team involved with Core Canada, the Pan-Canadian Healthy Aging Knowledge Hub. Thank you for joining us today, and I know you share with me in humbly acknowledging the traditional and ancestral homelands of the Indigenous peoples in this place we now call Canada, and in honoring the many territorial keepers of the lands on which we live, work, play, and gather. There are over 400 people registered for this session. I'm not sure how many will actually be joining us in person, but to help things run smoothly, everyone except the presenters will remain muted with cameras off. However, we would love to know who you are and where you're joining from, so please introduce yourself in the chat box. There will be an opportunity for questions towards the end of the session. Please use the Q&A feature and note who you are directing your question to. The session is being recorded and will be posted on Core Canada, and there will also be follow-up with those interested in continuing today's conversation. Oops, sorry. There we go. So today's session offers closed captioning and French translation, and we'll post these detailed instructions in the chat box so that if you don't memorize them from the screen now, they will be readily available for you. If you are having any difficulties with either of these, please let us know in the chat box, and Diane or Gemma or Aman will help you out with that. But basically for French, in your meeting webinar controls, click Interpretation and then click French. And for closed captioning, click the Show Captions button and select English. So today's session and the series overall emerged from some earlier conversations, ideas, and activities stemming from the publication last year of the book, Promoting the Health of Older Canadians, the Canadian Experience, Promoting the Health of Older Adults, the Canadian Experience, an edited collection by Irv Rootman, Peggy Edwards, Melanie Levasseur, and Fran Grunberg. Not long after publication, Health Promotion Canada and the National Collaborating Centre for Determinants of Health produced a series of webinars based on the book that explored public health action on health equity for aging populations. The webinars generated significant interest and created momentum towards further using the book and webinars as a foundation for generating more interest in action around applying a health promotion framework to guide the policies, practices, programs, and services that support seniors in Canada. And so this new series was conceived with the aim of moving from informing and educating to mobilizing to promote health and well-being for older adults. And you'll find some links to Health Promotion Canada and the National Collaborating Centre, as well as the webinars in the chat box. And these sessions, though, are not webinars, rather they're aimed at engaging participants to take action on various issues by focusing on effective health promotion models and the policies, practices, partnerships, and the networks that support them. Through interviews and discussions with practitioners, researchers, and policymakers, each session will explore a topic and the key issues and challenges related to it, and examine some strategies and programs that have been successful in addressing the problems. The first session focused on reorienting health and social services for older adults, provincial strategies for community-based senior services, and you can find the recording of it on Core Canada, and the link will be posted in the chat box for that as well. Following each session, participants will have the opportunity to more deeply probe and engage in the topic by accessing related resources and tools, and by joining a discussion group on Core Canada. The goal is to generate conversation that leads to action and change, all in support of advancing independent living for older Canadians. So we encourage you to check out the book, and today one lucky participant will receive a free copy in our giveaway draw, Compliments of the Publisher. To be eligible, you must be a session participant and online at the time of the draw following the presentations. So after the Q&A, watch for the draw. And now, I'm very pleased to introduce the moderator and organizer of today's session, Peggy Edwards. Peggy is a consultant, policy analyst, and writer on aging, and an activist for the rights of older people. As you've heard, she is co-editor and chapter author of the book, Promoting the Health of Older Adults, The Canadian Experience. And Peggy has worked with Health Canada, the Canadian Public Health Association, and the World Health Organization on the aging file, and has authored numerous policy and strategic papers on healthy aging at the national and international level. In her retirement, Peggy works with Grandmothers Campaign, the Grandmothers Advocacy Network, and the Council of Aging of Ottawa. She believes in the value of intergenerational solidarity. She now has a total of 18 grandchildren and great-grandchildren. That is about 14 up on me. So I can only imagine how busy she is with all the volunteer work and other activities and hanging out with those grandchildren and great-grandkids. So welcome, Peggy.
Peggy, you're muted, I believe.
Okay, sorry, can you hear me now? You hear me now? Okay, great. Thanks for that great introduction, Barb. I'm talking to you, I'm in Ottawa, Ontario, and I would like to acknowledge that this is the territory of the Anishinaabe Algonquin peoples. Indigenous seniors, Indigenous older adults make up such an important part of our community and bring so much to the community. And I wanted to stress that it's really important that we include their voices as we work towards developing and creating and sustaining age-friendly communities. And that, of course, is what our session is about today. And it is my pleasure to introduce our panelists and then to help facilitate, along with Diane Oikel, the discussion following the panelists' presentations. As was mentioned, please put your comments or questions for the panelists in the Q&A box. And also, please put your best suggestions in the chat box for resources, programs, contacts, good experiences that you have had with the development and sustainability of age-friendly communities. There will be a very extensive resource list going out to you after the session. And we will certainly look at those in the chat box and add those to it. So following this, you'll have a good list of other resources. So let's begin with Jim Hamilton. For over 45 years in Manitoba, Canada, and internationally, Jim has provided leadership and advocacy in building age-friendly environments. He served as a member of the National Seniors Council, Executive Director of the Manitoba Government Seniors and Healthy Aging Secretariat. He's been a special advisor to the Public Health Agency of Canada, and he's worked with the World Health Organization on developing the Global Age-Friendly Citizens Guide. Jim, we're so glad to have you here to share some of those experiences. So I turn it over to you to begin to set the context and the big picture of age-friendly communities.
All right. Well, thank you all for the opportunity to join you today. And I am joining you from my home office in Winnipeg. And I would like to acknowledge that I am located on Treaty 1 lands, the traditional lands of the Anishinaabe, Cree, Dakota, Lakota, Dene peoples, and the homeland of the Métis Nation. Peggy and I have been friends for many years, and we've collaborated on a lot of projects, always fun and always successful. Having said that, I always hesitate a little bit when her phone number or email appear on my screen. Today's webinar is a good case in point. Hi, Jim. I would like you to join our panel and speak about the creation of the age-friendly communities movement and how that fits with healthy aging. So as I listen, I'm thinking, okay, we started the age-friendly journey in 2006. Then came the 2015 World Report on Aging and Health, and last year's launch of the Decade of Healthy Aging. So I'm thinking, yes, I could do that, 16 years of global work. And then Peggy comes back and tells me, and you need to do it in 8 minutes, 10 maximum, because we want lots of time for the roundtable discussions. So once again, Peggy, thank you for yet another challenge. The World Health Organization continues to make valuable contributions to how we think about health and aging and how and where we should invest in our future. The three initiatives on this slide are the foundation for where we are today, and I believe where we need to go tomorrow. Interestingly, the WHO's vision for improving the lives of older people and their communities was the first of these three initiatives, their Age-Friendly Cities and Communities movement. Their first ever world report looks in detail at what we know about health and aging, and the UN Decade gives us a platform, a framework to bring the world report alive in countries around the world. So starting point for me, I believe an age-friendly community is central to healthy aging, and I'll come back to how the movement came to be. Gemma, the next slide, please. But what of the notion of healthy aging? As one key takeaway, like we all know, people around the world are living longer than ever before, 20 and 30 years. So we're adding years to life, but adding life to those years is heavily dependent on one factor, health. With good health, an older person's life will be little different than a younger person's. For others, poor health, chronic conditions can be prevented or delayed by engaging in healthy behaviors. And for people with declines in capacity, supportive environments can ensure continued participation. As well, the WHO has given us a new definition, a shift away from a focus on disease-based curative models to a new way to think of healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. So functional ability, put more simply, the ability to function, comprises three elements: the person's place, and the interactions between the person and their place, their community. Ultimately, our ability to age well, to function, and to do what we need to do is shaped by the person we are and by the interactions with the places we live. So what influences our health? The WHO notes that our health in our older age is not random. Some of the diversity we see reflects our genetic inheritance, but most is due to these person-place interactions. So let's start with the person. Personal characteristics include factors such as the family we're born into, our sex and ethnicity, our education, occupation, and wealth. These contribute to our social position and to our ability to access resources. And our behaviors are equally important: not smoking, exercise, nutrition, and certainly social connections. So healthy aging, our ability to function, is about the physical and the mental capacity a person can draw upon. The WHO calls it our intrinsic capacity, inner strength. Secondly, we have to account for our place. Factors that influence aging include where we live, our home, our community, transportation options, opportunities for recreation and socializing. And through our interactions within our community, we see that these places, our communities, offer us a range of resources, but also barriers that ultimately decide whether people can do the things that they feel are important. So we start to see why every older person is different, and these person-place interactions influence aging right from childhood. The UN Decade of Healthy Aging offers a framework for comprehensive action designed to improve the lives of older people, their families, and the communities in which they live. And we're living in the decade now. Launched just last year, this initiative is asking us to build an age-friendly world, to transform health systems towards integrated, person-centered care, and ultimately to address ageism. And I've often said, if it weren't for ageist attitudes, we would not need age-friendly communities. So back to that age-friendly world. Gemma, the last slide, please. Your work and your interest in age-friendly communities draws you into a unique, widespread global initiative. The value and the vision of an age-friendly community came into focus in 2005. The WHO recognized the need to respond to global population aging and rapid urbanization. Significantly more people were moving to cities, hence a vision for action at the local level that would foster the full participation of older people in community life and promote healthy, active aging. All of this consistent with the WHO's active aging framework, of which Peggy was a prominent WHO leader. So 3 fundamental elements to be aware of. The age-friendly movement is truly global. It reflects the voice of older people. And I have to say, Canada brought substantive leadership and capacity in building the movement. The work was led by Dr. Alex Kalash, who led the Aging and Life Course Division of the WHO. He established an international advisory committee to guide the work. There were 4 of us from Canada and a member from each of Mexico, Istanbul, Brazil, and England. The research methodology used to develop the Cities Guide, the Vancouver Protocol, yes, you guessed it, it was designed at an international workshop we held in Vancouver. That research was carried out in 33 cities in 22 countries around the world. Mega cities with over 10 million people, such as Rio de Janeiro and New Delhi, along with more modestly populated cities, Portland, Oregon, Melville, Australia, Kingston, Jamaica, and 4 Canadian cities, Halifax, Sherbrooke, Quebec, Saanich in BC, and Portage-la-Prairie here in Manitoba. Portage was the smallest city that participated across the globe. It was important that both developed as well as developing economy countries participated in the research, and Canada brought money to the table to make that happen. And who did we hear from? Well, the research was done largely through a focus group approach that generally included 8 groups in each city. At least 4 of the focus groups were comprised of city residents age 60 and over, and another 1 or 2 focus groups comprised of caregivers to older people, and most of those folks were older adults as well. So you can see the initiative very much is built on the voices of older people. We also heard from the public, voluntary, and private sectors. And the questions we asked: what are the age-friendly features of their city? What problems do they encounter? What is missing in their city that would enhance their health? Ultimately, that process gave us the age-friendly communities model. It comprises 8 domains in a unique framework that combines the social environment, the person part, with the built environment, the place part. And that really brings us full circle back to functional ability and those person-place interactions. But there's another issue for those of us in Canada working on this. We saw a gap in what we were hearing, realizing not all older people were migrating to cities. And for those folks in rural and remote places, what challenges age friendliness there? Service provision, distance, weather. So we modified the Vancouver Protocol, and we conducted focus group research in 10 communities in 8 provinces. The work was funded by the Federal, Provincial, Territorial Seniors Ministers Table, and the resulting product, Age-Friendly Rural and Remote Communities, a guide, was created and gifted to the WHO for distribution around the globe. So that's a big part of how we got to where we are today. And since 2010, the global network of age-friendly cities and communities continues to reflect the voice of older people, continues to grow around the world and across Canada. Just a bit on the network membership. It's not an accreditation for age friendliness. Rather, it reflects a city's commitment to listen to the needs of their aging population, to assess and monitor their age friendliness, and to work collaboratively with older people and across sectors to create age-friendly physical and social environments. Membership is also a commitment to share experience, achievements, lessons learned with other cities and communities. And lastly, on the network, I have to note that it's comprised of communities that have applied to the WHO for inclusion. And it's really important to know we have many communities in Canada and in other countries that have become much more age-friendly, but that haven't applied for WHO recognition. Great support from the Public Health Agency of Canada with its reference group that links leadership from across Canada together. And the one, just in closing, I wanted to add the Age-Friendly Universities Global Network. It's been led by Dublin City University. In 2012, they identified and adopted 10 principles of an age-friendly university. A number of universities across the world that have joined that network, and a number here in Canada as well, including the first in 2016, which was actually the University of Manitoba. So let me thank you for the invitation to participate today. I'll turn it back to you, Peggy, and our other presenters to tell you what age-friendly now looks like from where they sit. Thanks.
Thank you, Jim. That was, wow, so much information, and you have so much experience. Thank you. Next up is Suzanne Garon. Suzanne is an adjunct professor at the Université de Sherbrooke. She developed the age-friendly cities communities model in 2008, which was implemented in more than 950 cities in Quebec. Since then, she has been the principal investigator of the Quebec Age-Friendly Cities Research Team. And in 2017, she became the founding director of the WHO Collaborating Center on Age-Friendly Environments. Bienvenue, Suzanne, who will tell us a bit about the Quebec experience.
Thank you. Do you hear me properly? Yes, okay. Thank you for the invitation. As you can see, it's going to be fast. I'm an adjunct professor. I was a full professor, but now I'm retired, and we are staying on the land of the Abenakis people and the Abenaki Confederation, which is very interesting, by the way. So next slides, please. Next, yeah, thank you. It's a very, there's a lot of things on this slide, but I want you to take 3 takeaways. First of all, yes, to echo what Jen just said, we were Sherbrooke and the Research Center on Aging, where I'm from, where I worked for ages. We were part of the WHO initiative. So we had the experience of what was the research, but we had also the experience on how it couldn't be, I would say, grounded in a city. So in 2008, I had the chance of being asked by the Quebec government to implement, to build, to draw a program. And that's the second little box that you see. The second takeaway I want you to take with you. It's, and this program was buried with the 5 little points that you have below. I'm not going to talk about it today because I have more, but I'm waiting for you a question on that. But it has to be tied to the municipality administration. And the third one, what you can see in 1.5 years, I could say we could see a spread of this project, which was at the beginning a pilot project. And there's a reason for that. There's a lot of reasons and a lot of networks. And that's the point of my presentation today. We can't do it alone. We have to be working with others and with different organizations, and it's important. Next slides, please. Next, please. Next slide. Oops. Do you see the slide? No. I would need to have the slide. What I was showing you in this slide, it's going to come. I'm sure they're going to show it. It's the way with the approach of the model was made with the collaboration between different kind of stakeholders, different kind of organization. Yeah, thank you. You see in the right, in the bottom, the government of Quebec, the Secretariat aux Aînés, the senior secretariat. Thank you. And you see 3 other little wheels, and it's I would say it's the main organization of how things are doing in what do we need to make the program nationally. It looks like a bottom-up, sorry, a top-down approach, but it's not. It's just for the organization to make the changes. The CDRV, the first little books, but at the beginning up, it's the Research Center on Aging. The government of Quebec wanted to have a research team working with the cities, working with different partnerships. So we were, it was our project at the beginning, our program. So we kept working with them since now, something like more than, well, 14 years at the moment. And the one in the middle, it's the Espace Muni. Espace Muni is an NGO. It's an organization very well known for family affairs. It works since 30 years. It has long roots with municipality and family issues. It was called before Carrefour Action Municipale et Famille. Many of you work with this organization. And talking about networks, That was their network that made it possible that we were spreading. We had spread so fast because they had a very good network. They had about 300 cities at the beginning, and now the win-win situation with the AFCC program make them also more popular and more implemented in different kind of community. The third one at the end, it's an umbrella association of seniors organization in Quebec. You know, Quebec has a very long tradition of senior organization, the second most important senior organization after the AARP. It's FADOC, and it has in North America, it's FADOC, and it has something like 500,000 people, 500,000. So it's these networks are very important if you want to spread the good news of an AFC program. Next, please. Next slide, please. Oh, there's one before, I think. There were one before? No, before. Yeah, thank you. That's the, I would say, the more the bottom-up approach. That's the municipality working with different partners in the local level. It's very important to know that if you don't have the people, the cities by themselves can't do AFCC. They need partnership. They need to be working with different kind of organization. They need to work with health and social services. They need also to work with seniors, citizens, if it's not organization at that time. And this make, and there's a situation, there's a place for that. Next slide, please. And it's in the steering committee that you see at the first left of this slide. You see the first step for social diagnosis. But and it is very important to have a steering committee because it's the steering committee that makes the conversation about aging in the area. It's the model that I built at that time. It was very important for me that it was in a community building approach. It was essential because aging has to be is part of our reality, and it has to be part of the conversation as well. So this first step is to find out the diagnosis of your local community. It can be or your city and so on. And the needs, it's exactly what Jim just said about the Vancouver protocol with focus groups in every cities in Quebec. It means more than 950 cities at the moment had done these focus groups for themselves, with themselves. And we have, as research team, some of this information that we can work with. And after that, you have to, I'm not going to be all over the little dot, but one thing which is important is also the population. Why it's important, the population is so important, is because it's during this process that the mayors, the political levels, and even the administrative level in the city find out what is the image of aging in their community. Sometimes it's a blind spot. Aging is a blind spot for cities most of the time. And now, where are they? Where are the people aging? What are they need and so on? It's in this social diagnosis that it takes place. And with the words, like Jim said, of the older people, telling them what doesn't work and what it works in the cities, it's phenomenal. It gives a big shot. And they had to do an action plan for that, and they have to do in the action plan. You have different kind of action plan. I'm not going to go through that, but most of the time you can see partnership building around this action plan. And again, what is important for this slide, it's a 5 years that you can see process, and this 5-year process, when it's finished, they can apply on another 5-year process. And we had the opportunity to evaluate the first action plan to the second action plan after the 5-year process. And there's a lot of differences, and it's interesting. Sorry for the time, but it's I don't have the time to say that, but it is, and we tend to do it for 3 5-year circles. It's going to be probably another project after that. Next slide, I will take, so just the next slide. Just to show you that our research experience on aging that make us, I think, relevant for that kind of job. Next slides, I have to go faster. I was talking about the importance that we have to have a conversation on aging. Conversation on aging means talking the same language, so it has to make sense. So the way we did the research and the way we work with the partnership, the different partners, it's I would say iterative work, and we had to change some concepts. And as a research team, we are building different kind of tools at the end of my slides, and Peggy had also put these information on the tool kit that she has done. You will, I invite you to go to the Government of Quebec. I provide you a link, and you can see more than 20 tools and 2 guides to implement age-friendly cities or to have awareness on other issues. So, and for instance, here, Jane was talking about 8 domains. In Quebec, we had put a new domain, which is security. And it was not because we did think about it like that. It's because when we evaluate every action plan, they had put the people who were doing the process, who had put security as an issue that it was important for them. So like I said sometimes, and I think you will laugh at when I say that, we are running after the program because most of the people who are doing the process like it, they innovate on it, and that gave us a richness that we wouldn't have if it was just top down. Thank you. And next one, next slide. I brought you different partners that are present in the last survey that we've done. It's the Community Organization for Seniors, and you're not surprised of that. Health and Social Services. That's very curious, but because at the beginning, 2008, 2009, I would say they didn't want to be part of that. It was like that cities, and now since about 3 years, and we have a reason, we know why. They are a lot more interesting to be part of the project, and they are also part of the steering committees. And there's also the recreational organization that had before neglected the seniors population, and now they find out that it's a nice new playground for them to do. Next slide, next one. For them. Next. Thank you. Through a survey in 2021, we could evaluate the impact of the program, and according to the municipality. And we were very surprised to see how many things that were important for them. So we find out that the program promotes participation of seniors in community and social life. We're not surprised for that because you are very, like I said, I showed you it before. The seniors partners are very important in the process, but we also find out that it contributes the social and the community development of their municipality. I was very happy for that, because it's not like when we want to interest stakeholders on, especially on a high level of the political level, we say, when we do something for seniors, we do it for the whole community. And that's a good example with that statistic. And we could also see that it brought awareness on ageism. And I'm aware that it's important because sometimes they didn't even know the name, the word of ageism. But through training that we provide to them, through a lot of exchange, now they see it's a real problem, it's existing. And the last one, which is not the least, it contributes as well to the economic development of their communities. That's interesting, isn't it? So can you just change the slides? In conclusion, and we still have a challenge on that. Doing that, we see that this conclusion is made with different kind of data sources and data collection, but it is also done with the government agencies for evaluation that they have done themselves on the program, but also other agencies of the government. For instance, the one that is promoting the rights of people with disability. They find out that when the action plan of the AFCC city was well done, their own population was having a easier way of life because the adaptation of the living environment to the reality of the seniors is very similar to the one with handicap, with disabilities. And what they also, what they have said, it's starting to have like a reflex. We call it reflex aîné. It's thinking and acting about elderly to think that when you have a new policy, you have to think about this population. It's not just the former blind spot that I was talking before. It's starting. It has to be taken into account. And of course, one of this the main interesting for that, it's for us, it's to increase as well the networking and the collaboration among community partners, and that is data that we have seen all over the process, either with data collection with different kind of surveys, but also with focus groups, and also with when you look at the representation of different cities where they put their action, what they want to do, and we see that to take care of aging population, you have to have a network. It can't be done only by the city. It helps. We used to hear things like to raise a kid in Africa, you have to have a village. To age in a community, you have to be a village. You have to be a community. You have to be working together, and that's what is it's important. And I think it's one of the thing that we see in different experiences in Quebec. The next one and the last one, it's the question of the big challenge that we have. The AFC program brings a lot of things. It changed things, but regarding the most important challenge that we have, Jim talked about it before, and it's very well known by the WHO. We are aging longer, but we are not necessarily age in good health. And if you look at this challenge, we see increased population of people who are going to age longer than 90 years old. It might be, those people can be frail and so on. And the challenge, why I brought this slide to you, it's as good as can be AFCC community, the way we build it in Quebec, we're not taking enough time. We're not, the model is to be always a to build on participatory, and for people who are for them, it's difficult for them to be part of the population, active population. The program doesn't do enough, and it doesn't reflect this reality. And we for this reason, we are working now for different kind of program that would be even more place-based, more in the micro territory, to be sure that we don't forget the people who are the most frail and the most and the one who still either to live to their place or live in the cooperative, but that they still have be taken into account. We have to, I think the AFC model, the way I showed you today, the way I build it, has its limit, and it's important to see it. But to have, like I said, we have to think more precisely on micro territory model to do that. Thank you, and it's next slide. And I invite you to look at the different website that I provide you on this slide. The first one is a real library. You can find, like I said before, many documents, many tools, and they're all free. And if you want to adapt them, you're free to do it. It's the research team who have done that. Just have to notice, acknowledge the work of the research team, but it's good for that. It's a free public domain stuff. And the other thing, of course, Espace Muni has also tools, but they are living with the tools, so it's not the same public domain tools. But I invite you to go through this website, and it's going to be finished. I think I've done it in the 8 minutes I had.
Thank you so much, Suzanne. Wow, again, so much information for us to take in, but a lot of very clear tips, based on evidence, based on your research on what works and what's really important when you're building age-friendly communities. So our next speaker is Sarah Webster. Sarah is manager of the Center for Studies in Aging and Health at Providence Care. She began her career in long-term care and retirement home programming, and later transitioned into the field of knowledge translation and exchange. Sarah helped build Age-Friendly Communities Outreach Program, the Ontario program, through her knowledge brokering role, and now manages the provincial program. Sarah is passionate about aging, age-friendly communities, and knowledge translation and exchange. Sarah, over to you.
Great, thanks, Peggy. So today I'm going to talk to you about what's happening in Ontario. Bear with me for a sec, my slides are not, there we go. So the strategy in Ontario kind of started to take root in 2013 when we had a provincial planning guide or age-friendly framework that was released. But the guide had limited uptake. As we've seen a lot, these things kind of end up sitting on shelves without more of a strategy around it. So in 2015 is when our movement really started to take off here in the province, when the ministry invested not only in age-friendly planning grants for 56 communities, but also in our provincial outreach program. Since then, we have had one series of recognition awards, and then a couple grant programs that have supported age-friendly community implementation at a local level. And last year we released a revised planning guide. So today I'm just going to focus a little bit on our guide and where that's at, and then the supports offered by our provincial program. So in Ontario, our development is guided by a planning framework and companion documents, including a diverse populations addendum and a AFC planning toolkit. That planning framework really walks communities through 4 interconnected steps of defining local principles, which is really pulling your group together, that Suzanne was talking about, all the players that need to be involved to make this successful. And then doing that community level assessment, developing an action plan, and implementing. And in the revised guide, we've now embedded throughout strategies to help communities look at evaluation and sustainability as components that need to happen throughout the planning process, and not kind of end goals that they need to pick up in the 11th hour. So that's new in this current version of it. And our 70+ communities in Ontario all are engaged at some part in this action cycle. We have communities who are also going through multiple cycles, as Suzanne mentioned, where we have communities that have reassessed their community needs and looked at where there's emerging gaps or issues that need to be addressed. So our outreach program, we're a provincial knowledge translation and exchange program, really to support that development in Ontario. So we are a very small but mighty team, and our goals are to strengthen community capacity, increase that collaboration across the province, and raise awareness about age-friendly benefits, promising practices, and those planning principles. And I'm just going to walk quickly through some of our core facilitation strategies that we take at a provincial level to support what's happening locally. So the first is our wonderful knowledge broker, Emily. The purpose of this role is really to connect people, ideas, and resources. So Emily's the human person, the voice on the end of the phone. She's there to answer any and all age-friendly questions from as general as what are the benefits of an age-friendly community to do you have an example of a terms of reference for a steering committee, to where is their health strategy for falls prevention that we could take up in our community. She connects people to resources, to innovative strategies, to other people. She offers advice, provides presentations, manages our online profiles, which I'll talk about in a bit, and provides letters of support. And the best thing, what I love about this knowledge broker role, is that she doesn't have all the answers. We are very careful to make that clear. But she's curious, and she's always happy to help find answers. So we like a challenge within our team. So any questions that come in, we like digging a little deeper to figure out what we can find and how we can help people. The second strategy is really to facilitate these collaborative networks. All of the networks are really aimed at sharing those promising practices and looking at ways that we can respond to emerging challenges. So we support 4 regional age-friendly networks in our northern, eastern, central, and southwestern areas of the province. And these are leads from those areas who come together bi-monthly to share what it is they're working on, great strategies they've come up with, or issues that they've encountered. And there's a lot of lively discussion that happens on those groups. And then the other 2 mentioned here, the Age-Friendly Business Working Group and the Community of Interest on Social Isolation and Loneliness. Those have emerged in response to needs we've seen in the province. And this is where I think we've been very lucky to be situated and funded in a way that we have discrete deliverables that we need to hit, and milestones we need to hit as a provincial program. But we also have this flexibility to be responsive to what we're hearing. So certainly out of the pandemic, the social isolation piece, there was a lot of interest in how we can respond to that. And that group was born out of that. The age-friendly business has been in the works for a while because we were hearing a lot of communities that were really starting to, well, I'm developing a checklist. I'm developing a checklist too. And so why not bring people together to look at how to do things in a more coordinated and collaborative way. We do produce a monthly e-newsletter. I think our distribution list is about 1,200 people right now. And that newsletter highlights funding opportunities. That's always a big hit. We just had one go out today actually on that. News stories from not just in Ontario, but nationally and internationally as well. Resources, age-friendly resources, and events that are happening. We host a webinar series really aimed at sharing a lot of times those local level strategies and talking about implementation, what that could look like, or lessons learned from a local level. And we're just gearing up for our fall winter series. We had our first one a couple weeks ago, and our next one's coming up too. We have a pretty comprehensive website, agefriendlyontario.ca. And this is really where everything about our program, the planning guide, what communities are doing across Ontario, this is kind of the place to go, as well as a really extensive resource list. Anytime we find something about age-friendly, it goes on there and it's grouped by various hot topics of interest. On the website, you'll also find interactive maps. And this really allows us to visually see where communities are engaged in this work. It's kind of our most up-to-date glance at who's doing this across Ontario, color-coded by population size. And anyone can click on the community name or on the pin to be taken to find more information about their age-friendly work. And then the additional layers of the map, by toggling on and off, allow you to overlay to see where strategies or initiatives are happening specific to one of the 8 domains. So if a community is looking for examples of housing strategies and they're in southwestern Ontario, by clicking on the map, they can see some of their neighboring communities that maybe haven't been engaged in similar work that they could draw on. On the website, we do have profiles for most of our age-friendly community initiatives. And this is really a description of who the committee is, their population, any contact information, a description of the program, any current or completed projects or programs, and then any resources. So if they have an action plan or a needs assessment summary, we put it on there. And then the final piece is taking a step back and more at a provincial level. So we do, for the past 5 years now, we've conducted an annual provincial survey. And this goes out to the leads of those age-friendly initiatives, currently about 78. with the purpose to really monitor and evaluate implementation, sustainability, enablers, challenges, benefits. And then we repackage that to look at, okay, what are the results over time? Like, what does this movement look like over time? Are we seeing any differences at a regional level? And then what's happening at a provincial level, any differences based on sizes of communities, et cetera. And this really helps us understand how people are using our supports, and what else is needed so that we can shape our support going forward. And we report those findings and key takeaways back to the age-friendly leads, along with their individual responses, so that they can use those to make a business case at a local level. They can draw on those results. And we also report those survey findings back to our ministry partners to inform provincial decision-making that goes on. And so I've put some links up there to explore our website, to contact Emily, to join our e-newsletter distribution list. I'll say that one of the joys that I've seen of seeing this provincial program develop is that, as I said, it is responsive, but it really allows us to be in this kind of connector space. I had a colleague who described it as helping people plug in. So connecting the power, the passion to the power, the purpose to the power. And certainly in Ontario, anyone I've met who's involved in that age-friendly space, there is no lack of passion and purpose, but sometimes the power is needed. And that might be connecting, as I say, to funding opportunities, but sometimes it's just the power of people, that we can't do this alone, that we need to be connected and feel like we're part of a bigger movement. And so that goes a long way. So that's really been one of the exciting parts of seeing this program develop. But I will stop there, and I'm happy to answer any questions in the Q&A. I'll turn it back over to Peggy. Thank you.
Thank you, Sarah. That was a great presentation, and a wonderful program in terms of, as you say, connecting within a province. And encourage all of you who are at this session to visit the Ontario program website and the Quebec websites, and to all, you don't have to live there to benefit from the toolkits and the various things that they've developed. But I would also like to acknowledge that the other provinces all have networks at the provincial level with guides, etc. So one of the reasons we decided, and we couldn't have everybody, but we decided to have 2 provinces tell us about their experience, was to show you the importance of this networking and how we can learn from each other through sessions like this and through these programs. But in where the rubber hits the road is at the municipal level, right? And so our next speaker is really coming at it from that point of view. Rob Mayashiro's work has centered on human services program development for almost 4 decades. And he's been executive director for the Lethbridge Senior Citizens Organization for 14 years. Rob has also served 2 terms on Lethbridge City Council. Rob is chair of Age Friendly Lethbridge and is the Alberta representative on the Pan-Canadian Age Friendly Communities. Welcome, Rob. Turn it over to you.
Thank you very much, Peggy. I really appreciate that. And, it's interesting that Suzanne started talking about collaboration, and then Sarah talked about how the communities need to be connected and feel connected to the age-friendly work and the age-friendly network. So I'm going to talk about this from a different perspective, not just municipally, but I'll focus on that at first. But I'm also going to talk about, I just wanted to touch on the whole reason for this session today is that talking about age-friendly as a key strategy in promoting the well-being of older people. And so I'm going to make that connection that some of the others started to make, and I'm going to make it in terms of what do we do locally, how does that connect to what we do provincially, and how does that connect to what we do nationally and internationally? Because I think this just kind of forwards the stuff that Sarah was talking about how the local age-friendly groups need to understand that there is a connection to a wider network regionally and internationally. So one of the things is that we saw in Lethbridge is like way back in 2005, our city's community and social development department worked with some seniors to create a conference for seniors and service providers and called it the Seniors Community Forum. This conference was held annually for a few years, and the organizers eventually became an interagency group. Next slide, please. No, yeah. So, sorry, in 2016 and 17, at the Provincial Services Conference, there was a session on age friendly. And so this sparked a change in the Senior Community Forum, and we became age friendly. And I noticed one of my colleagues from the government of Alberta, Carol, is here. And Carol is actually the person that I saw really inspired her session, inspired myself and someone from that worked for the city of Lethbridge to say, hey, we need to change our Senior Community Forum into an age-friendly initiative. So this enhanced working relationship that we see between the age-friendly groups and things like Seniors Community Services Partnership, which we help create to form our own senior services ecosystem in Lethbridge, as well as things like the Lethbridge Elder Abuse Response Network and other agency, interagency work. It creates the system that doesn't just include our regular age-friendly people, but all services that serve seniors, and in the hopes that we draw them into our age-friendly initiative in Lethbridge. When COVID hit in the spring of 2020, the city of Lethbridge asked a whole bunch of people from social helping organizations in our community to answer a question, and that was, how do we continue to serve and support our vulnerable populations during COVID restrictions? And so what we did for that is we got everybody together, and there was probably over 50 organizations. Next slide, please. There's over 50 organizations, and we used a platform called Slack to connect to each other. And Slack, if those of you aren't aware, it's kind of a combination of email and text messaging, but you can also share documents, and you can also just connect instantly with other people, and you organize it in terms of interest groups. So it was the first time ever in my long history of human services in Lethbridge that all the people from the different sectors working together. And in our age-friendly group, of course, because we work with isolated seniors and all seniors, we were a big part of this core, because now we were part of the largest service community in Lethbridge, right? So what that did for all of us is that we were able to connect in a different way, using age-friendly from our perspective as kind of the core for the seniors group as part of our helping organization response, and to create an entire community response to how do we serve people during COVID. Next, please. So let's go back. Someone asked a question earlier, I think, is about how do you connect to the age-friendly movement? Well, so once our age-friendly Lethbridge group expressed our interest into being a part of the age-friendly process, we applied to the provincial government, and then they invited us in turn to participate in the Alberta Age-Friendly Community of Practice, and that again was Carol I mentioned earlier. So, and this community of practice, it's communities from across the province. I think there's 18 now. When I originally did this presentation, there were probably only 14, but I mean, ranging in size and scope from Calgary and Edmonton, Lethbridge, Strathcona County, to smaller communities like Innisfail and Banff and Cochrane and Olds. And so what we formed in that group is that it's another collaborative, but on a different level. So instead of working on certain issues as a collective group, what we do is help each other to develop the best kind of age-friendly planning and implementation as possible. And we've met over the last couple of years online, and all of our meetings have been online. All of our information sharing has been online, and it's been a really effective model, because we can still work very well together, But we can do things like I've actually been fortunate enough to sit in on age-friendly committees from across the province, like Cochrane and Innisfail, and have a chat with those groups about our experience in Lethbridge and the benefit of our experience in developing our age-friendly plan and our age-friendly work plan. So it's again another form of collaboration that helps move this initiative forward. And again, keeping in mind who's at the middle of this, and that's the senior. Are we doing this to help seniors? And if we're not, then we don't do that part of it. And again, I kind of touched on this earlier, but what we do is it's a mentoring and an assistance group. We also did a really cool thing this year and participated on Healthy Aging Core Alberta, which is of course our provincial version of Core Canada. And what we did was we disseminate age-friendly information. Our last effort was last spring, and we did a multi-part series on housing from an age-friendly perspective. So we looked at a bunch of different aspects of housing, and all the participants and the attendees could take away a lot of really good pertinent information for their communities on all these topics. So I think that's a method we're going to go ahead with, is pick certain things with within the age-friendly framework and say, okay, now how can we present this in a way that's going to be useful and understandable for people? And the other thing we do is that we help, of course, with municipal resolutions, and we help with discussion about engagement strategies, and again, helping people with their community planning and work plans in an age-friendly perspective. So then we make this next connection. So two things. One, because I have a big mouth, and one, because I can't say no very well. But we at the time that I came on, I was a municipal councillor, and so that was my role in that. And then when I got off council, we needed another rep from Alberta. And so I agreed to stay on as an Alberta representative on the Pan-Canadian Age-Friendly Communities Reference Group, which is a larger version of our provincial community of practice. So we also meet online. We do Zoom, or we do whatever the government platform is. We also communicate through a medium called GC Collab, which is a Government of Canada platform to share information. But it's the same kind of thing. So I noticed too, some of our attendees today, Connie from Manitoba is here, as well as Claire from the Public Health Agency of Canada. And it's our ability to connect the same way, but now we're not talking about provincial and regional issues. Now we're disseminating information nationally. So we can learn from people in New Brunswick and Manitoba and Saskatchewan and the territories. And we can have those discussions about how does this work, and can we translate that information and that knowledge into a local perspective. And as with all these other things that we talk about, all of us bring that back to our, if we're involved in local initiatives, we bring it back to our local initiatives. So the things I learned at the Alberta Age-Friendly Community Practice, I bring back to Age-Friendly Lethbridge. Excuse me. And the stuff that we learn nationally, we also bring back to our provincial group, which I then bring back to our local group. So it's that kind of information sharing that gets from the high national level, and then we get it right back down to our local level again. So here's kind of the summary that I came up with that we can look at and give people a perspective as well, is that, and this is, I'm just repeating what people have said earlier, is that age-friendly communities cannot and does not work in isolation. So if you look at it this way, so our Age-Friendly Lethbridge, our local age-friendly initiative, the collaboration is interagency and intra-municipal. Right? It's all within our own community, and how are we making things, and what are we working on to make things better for seniors in our community. And that feeds into the Alberta Age-Friendly Community Practice, where the collaboration is intermunicipal and interprovincial. So we're feeding things between communities and then between provinces. The Pan-Canadian Age-Friendly Communities Reference Group then is, the collaboration there is interprovincial. and international, because the Public Health Agency of Canada is our conduit to the World Health Organization. So when we get to that point, any information that we have from Canada is fed into the World Health Organization's global network of age-friendly cities and communities. And I think that's the key that I often talk to our group and other groups about, is that you're not in this alone. And the kind of work that you do on a local basis has ties internationally. So when you finally get to the owner's process of applying to be part of the global network, then your information gets online, and then you can get working. So one of the benefits, I forgot to mention this earlier, but when I was talking about the COVID response from the city of Lethbridge, because I was involved with the Pan-Canadian group, and at that time there was a call for initiatives around the world, so that the World Health Organization, the UN, could recognize in the early stages of COVID, to talk about how your communities are responding. And I worked with some staff from the Public Health Agency of Canada to develop a proposal about our local initiative in Lethbridge. And luckily, in the fall of 2020, Lethbridge was recognized on World Cities Day as an initiative to a collaborative initiative to deal with COVID in a way that they hadn't seen before. So we were pretty proud of that fact. So I hope that's giving you an idea of how to kind of get from local to international, and I hope it was helpful.
Great. Thank you so much, Rob. That certainly was helpful. Boy, there's a big theme going on here about collaboration at all levels, and we've heard it from all levels. We're going to go to some Q&A in the chat box, but Jim, I saw a message that you may need to leave. No, not you. Okay, it was another Jim. Okay. All right, so I think most of the questions in the Q&A were answered. Diane from the chat box, my goodness, 99 messages in there. But you're so good at this. Are you able to pull out a couple that we could direct towards the panelists?
Peggy, we do actually have one question.
Okay.
And I think Sarah can jump in and answer this, and then the other panelists can probably respond as well. But question is, have Indigenous populations been included?
Okay, a good one.
So in Ontario, when we were working on developing our revised guide and that diverse populations addendum, that addendum does have a chapter addressing engaging Indigenous communities and what does that look like within an age-friendly context. And through that, there was a consultative process to inform that. At a local level, when we've done our provincial survey and we've asked communities to identify what groups they're working with and what populations, about a third of our communities have said that they're engaging with Indigenous partners. But where we've realized there's a lacking component is it's not clear whether they've spoken to one person or whether there's authentic engagement and partnership. So we've revised that area of the survey for this year, and we're hoping that in our next iteration in January, we'll get a bit more clarity on what that engagement looks like. But we can post the diverse populations addendum as a resource as well.
I can answer to that. Yeah, there are Indigenous communities doing the process. They change a lot of things in it, and unfortunately we don't have the resources to evaluate that at the same time it's been done. But I can provide the name of the person especially like I said for the panelists before. There's a little town near Quebec City. It's called Wandake, and they have a very implemented method to do ASCC, and they are great. They do things, and I learned a lot when I was still working with them. I mean, at the beginning, before my retirement, and I have been asked to be part of a study, but it's not founded yet. And in a way, it's the person or the people who are doing that in 1 decade. They are, I can provide their names. I can provide a way to communicate with them and how they do it, but they make it to their hand, like they say. They don't ask exactly the same question in the focus groups, for instance. They don't use exactly the same domains. It has to reflect their own reality, and they do it very well. And before that, in 2000, I think 12 and 13, the Quebec government worked with 11 cities, a little town in the north of Quebec. And they worked with an anthropologist who worked with them on the process. And one finding that she come up with, it was hard to implement a process or age-friendly community, because all the people were telling her, we have problem with our youth, our young people, and it's not time to talk about us, it's time to talk about them. And that was one of the problems they had. But also, again, I can provide you the name of and a phone number of a person who worked directly with these 11 communities.
Jim, did you want to add anything?
Well, I think I've been part of discussions over a number of years about the interest and the value of an Indigenous-led research project that could look at, the Vancouver Protocol adapted appropriately, or come up with something completely different to engage, in a range of communities that way. I'm not aware that anything specific has happened on that. I can say that when we did the age-friendly rural remote communities, Alert Bay in British Columbia was one of the communities. So that brought some perspective to the rural remote. In Manitoba, we've had a largely Métis, small community of about 80 people on Lake Winnipeg, predominantly fishers, and they've joined the Age-Friendly Manitoba initiative. So that's been a neat inroad and experience, and sort of a role model to some of the other like kinds of communities. But I would love to see a research project led by Indigenous researchers that could look at how do we make this really make sense to First Nation and other communities.
Thank you. And if I could add from more of a personal experience here living in Ottawa and involved in the age-friendly community, the recent census data is absolutely amazing in terms of the increase in the number of Indigenous peoples and including Indigenous and older peoples in my city, for example, by 37%. And what has happened is many people are coming to Ottawa for healthcare, and they stay. But the other thing that is happening, which is very exciting, is that young professionals are coming to work here in the city, and they're quite often bringing their parents, the older parents, with them. So I think, when you look at a city which traditionally has had a very small Indigenous population, that's changed. And so every city needs to look at their age-friendly plan, their age-friendly community, and how it includes the voices of older Indigenous people. Okay, Diane, can you give us one?
We do have a couple more questions in the Q&A.
Sorry.
Yeah, no, they're coming in now. So
okay.
So the next
okay. Yes, I know. Okay, I'm seeing them now. Yeah. So Sherry Torshman, welcome, Sherry. Sherry is one of the authors on the book and is a policy analyst. Sherry is asking, are there any interesting intergenerational initiatives around creating age-friendly communities? Anybody want to talk about that one?
I can add a couple from Ontario. There's certainly been a recent interest around intergenerational programming, specifically in addressing ageism and increasing social participation. We've had ones like housing initiatives, like our home share program in Ontario, which is like a co-housing, or not co-housing, a home sharing between an older adult who has an extra room that they rent out at reduced rent in exchange for some services. We have the Grandpals program, which is being expanded across Canada right now, that pairs students with older adults for long-term relationship building over the year and storytelling and friendship. And then we've got programs that are focused on, say, walking programs, or where there's like an exchange of skills or a letter writing program. So we're starting to see more of those components. And I believe that there was a community, I don't have it off the top of my head, but that was really focused on engaging youth on their age-friendly committee, which I thought was great to see. We talk about engaging seniors in this process, but also how do we, if we're creating these inclusive communities, how do we engage youth in that process as well?
Great. Thanks, Sarah. Anybody else on this one? Jim, you got your hand up, and Rob.
Yeah, thanks, Peggy. I would just add the Manitoba Association of Senior Communities website has about half a dozen age-friendly videos that were done in various communities. One of them was done in Harrison Park, just north of Winnipeg, and it's intergenerational. The older people in the community got together with junior high school students, taught them the old time dancing, and also reciprocal was some of the technology and sharing. So a really neat intergenerational. There was an intergenerational band in the town of Pinawa, Manitoba, that brought together folks of all ages, and lots of neat quotes from the younger people about that experience. And, you know, I would never have met that older person if it hadn't been for the band, kind of thing. And we've certainly, you know, models where high schools are represented on an age-friendly committee in different communities. So I think there's lots of really great opportunities. You know, as said right from the beginning, you know, the age-friendly community philosophy movement is about people of making the community friendly for people of all ages. And I think that's really true, and it can work well. So.
Thank you, Jim. Rob, and then Suzanne.
Yeah, so really quickly, in Alberta, there's an organization in Calgary called Linkages, and it's link in all caps and then ages, AGES, and their website is actually link-ages.ca, and the whole organization's goal and reason for being is to do intergenerational work. And so if you go to their website, they have some great resources, and they're very willing to share information and talk to groups about how can you do better intergenerational program, and they're really good about wanting to share that and have people learn from their experience.
Great. Suzanne, you had to add something to add?
Very fast. Yeah, two things. One is through the process of age-friendly cities and through the process of addressing questions about aging, there are many little cities that have been put in place, like we call maisons des aînés, seniors' houses, and they do work with schools. They do homework. They help for homework. I don't know where it comes from. I think it comes from. It's an idea that it's been picked up. I don't know if it's in Ontario or in somewhere in North America, or maybe in France. I don't know, but it works quite well, because the people who are going. I mean, it's a very intergenerational, because they help the young kids to do their homework. Sometimes it's not that they have the answer, but they have the place where they can concentrate, talk to them, and so on. And sometimes it's also former teachers who are there as seniors and help the young kids from. It's an elementary school mostly. And the second thing, it is a lot of more. People talk about multi-generational or intergenerational. They say even in aging, between someone who is 60 and a mother is 90, we have to take that into account as well. It's intergenerational, and I like the idea that it's a lot broader than gray hair and blonde hair.
Yeah, very good point. Thank you, Suzanne. I did.
Sorry,
Barb, go ahead.
While Suzanne's unmuted, there's another question that she may want to start with that came in earlier. Do you evaluate the number of seniors by community and not larger areas, and see how many seniors really use the programs and services offered?
If the question is that if you evaluate the number of person going to the product.
Yeah, do you evaluate the number of seniors by community And not
by
large-
community. We have the
and not
percentage.
large.
Yeah, we have the percentage of the community. That's what they do have to do, actually. They have to find out in the diagnosis phase 1 of the program. They have to, one of the things they have to do, it's where are the seniors, how many percentage it is, how it was there 5 years ago, for instance. We've seen cities that, for instance, we've seen cities which are in the very suburb from Montreal, and they're only 5% of senior people from 65 years old, 65 and older. But 5 years later, it's something like 10%, because that's the grandparents moving where where their grandchildren are, and that makes big challenges for those kind of cities. But we don't do as evaluation. We don't follow the users. That we don't do that, because we want to see the environment, not the individual. We want to see what is changing in a city. For instance, did they adapt lights, traffic lights? Did they adapt stops, signs, and so on? That's what we're looking, and we do have this information in the action plan, because they had written that if they do it, they plan to do it in the action plan. And when they go back to receive other money, or when they have to make an assessment of what they have done in the action plan, so we can find the gap between what they wanted to do and what they really did. Do I answer the question?
Yes, thank you. Rob, you had something to add?
Yeah, so I don't, I think further to what Suzanne said, it's not really a matter for the age-friendly groups or the age-friendly communities to do that work. That's more the work of our member organizations that are doing the work on the ground, right? And so in Lethbridge, our Seniors Community Service Partnership, like I said, it provides a really great ecosystem for services for seniors, all the way from outreach to in-home supports. The best way for us to understand it may not be as much how many people are we serving, but who aren't we serving. So it's really important for us that the deal in this population, which tends to be more isolated, is who are we not getting to? When we were at the BC Aging Summit, there was a session on emergency preparedness. And one of the things is, when these emergencies happen and these disasters happen, it's more important to know where the people are that are isolated and that aren't connected than it really is to know the ones that are connected. And I think we've been doing we've been trying to find those people through things like Meals on Wheels and subsidized lawn care and snow removal, in-home, our homemaking services, things like that, and in our volunteer community connect program. And so I think in a broader sense, age-friendly community groups can encourage all their member agencies to figure out a way to find those people. And I think that will provide just as good of outcomes in the long run as just doing the count for your outcomes for service.
Thank you. Okay, excellent answers, good things to think about. In the interests of time, Barbara, I think we'll just move on with one last quick question for the panelists. Suzanne actually answered this in her slides, but my question to you in 2 minutes, what's the biggest challenge going forward? And what do you see as the most important solution or way to address that? Jim?
I think the biggest challenge is competing demands. I think there's a lot of really important issues all across the country, locally, provincially, nationally. So Age Friendly is competing with, the attention of elected officials and everybody else, the business community. And I think, how do we solve that? I don't think we do, but I think we need to, the WHO has a nice slide on this, but changing the dialogue from cost to investment and taking a look at, the return on the investments. When we look at the cost of an age-friendly community, the cost of services to older people. It's an investment, and what's the return on that investment? And I think we all need to be champions of that kind of thinking.
Great. Rob, biggest
So,
challenge?
yeah, so the big challenge, I guess, for us, and I think for every community, and I've talked to my colleagues across the province about this, and sometimes nationally, is that it's very important that there's as much municipal involvement as possible. And this really is kind of back to what Jim said as well, is it starts at the municipality. You can't have an age-friendly initiative unless a municipality signs off on it. In my community, since I've left city council, there's been very little staff involvement in the age-friendly movement. And I've said this to our Alberta age-friendly community of practice in different communities across our province, is that it's imperative that you keep the heat on your municipality to have a direct connection between your age-friendly group and your municipality. We have no city councilors involved in our initiative, and we have no staff right now involved. And it's a battle for me all the time to talk to my former colleagues and the former people that I know in administration to get someone connected to our age-friendly initiative. Because it's the only way that's the only constant to move forward is to keep that municipal contact, or it's going to die.
Right. Sarah.
Yeah, absolutely echo that. Our survey shows the top two challenges for communities is the competing priorities that Jim mentioned, and then the lack of dedicated staff. And that when we look at enablers, it really comes down to those champions. Rob, you've hit it on the head in terms of the municipal champions, and then having a community champion, and an older adult especially is really helpful to kind of keep that momentum. And with the lack of dedicated staff, what we've seen is that if it helps to have a single person who's a point person at community, but spreading the work out, that collaboration we've been talking about is so important, because what happens is if one person leaves and everything's been on their shoulders, the whole thing's collapsing at a community level. And that's where we see some discontinued communities or paused communities because they've lost that momentum. So having the champions, but also spreading out the work and looking to ways to collaborate.
Great. Suzanne. Suzanne, you're muted.
I know I don't have
there
so
you
much
go.
problem to unmute. Sorry, for Jim. Jim is so right, and this methodology in economic it's called social return on investment. And now this one study that has been done by Cambridge University, and I invite the people from the federal government to invite Louise Lafortune and her team, who is doing that since 2 years, and it's good. I think it's a very important standpoint at the moment, because we will have data that I'm on the advisor committee. I think she's very near to have real data to say $1 that invested this way can save how much X dollar normally if you don't add it. And to answer to the question of Rob, I was talking about this great organization which name is Espace Muni, and they do training on aging because they were working with the Secretariat aux Aînés, and they label one counselor in each city as person who is relevant for family and aging population and seniors. And in every city, they receive at the beginning of after the election, when they start a new municipality council, they receive a training. They give a training for them, and they name that. It's like you have someone for the road and so long, but you have also someone for family and seniors. They call it RQF, and it's very interesting.
Thank you, Suzanne.
It
Great.
makes it more permanent in a way. It's not just a person.
Yeah. Okay, thank you. And thank you to all of the panelists for your presentations and for your engagement. You've given us so much good information. And I'll hand it back to Barb to finish up the session.
Yeah, and while I am sharing my screen and getting organized here, I'm just going to ask Diane to jump in to announce the winner of the book draw.
Yes, I did a random sorting of names, and the name that came up was Odessa Ditson. So I think Odessa is still online, so congratulations.
And
So-
Odessa, make sure we have your email address, and we'll get the publisher to be in contact and send you a copy of the book.
Great. Wonderful. So congratulations, Odessa. And thank you, Peggy, Jim, Suzanne, Sarah, and Rob. And as I said today, to wrap up today's session, we're going to very quickly look at how we can continue this conversation. Because as we've said, these sessions are just a starting point. They are being recorded and made available as resources on Core Canada, and other related resources will also be included alongside. And we will be sending out the resource list at some point that Peggy mentioned. And we'll add new resources that came to light in the chat box from today's session and share them with those who are interested, as well as posting them on Core, where we will create a group so that those who are interested can access and share resources and continue to do so, as well as stories and examples of age-friendly communities and programs, and connect with each other interprovincially. And who knows where that might lead. So again, thank you to our presenters, our Health Promotion Series Advisory Group, and especially Peggy, who planned and moderated this session, and Diane, who managed the chat box so efficiently, and to our Zoom and tech whizzes, Gemma and Aman. And thank you to all of our participants today for taking time out of your busy day to join this session. We're taking a break until the end of the year, but please join us on January 26th, when the next session will focus on housing and living arrangement options for older adults at home in community. Thank you.